Hi, Discovery New You family. I hope you missed me.
Other question. So you talk about foods that we can eat to help. What do you what would you say are some things that causes UTIs? I
Okay.
know a lot of young ladies are, I think, for lack of proper taking care of, they
Hmm.
end up getting a lot of small things they can avoid. And so let's talk about some UTIs and how to avoid them, what causes them,
Okay.
underwear, all this stuff.
Okay. In my practitioner life, when I first started, I started with women's health clinic,
Oh,
and that was when I was exposed to UTI. I've never
what are
seen
UTIs?
urinary tract infection,
Which you talk about that same track that when
aka
we wash
right
ourselves,
when you
we don't
wash.
do it properly,
Mhm.
can bring up
Infection,
those bacteria,
bacteria.
can travel up there.
Right.
Okay.
Okay.
Just keeping us on track.
All right. So urinary tract infection, they get it through the or the perineum area, the private parts, the vulva, right? So when I worked at the women's health, I got a whole lot of UTI, and I was like, this is a lot of
Right.
people with UTI. Why is that? So I've started part of my journey to why, what's going on? Question. Because I will see some patients with UTI, they come to their, OBGYN to look into it. And in Western medicine, we are taught the script. If they have UTI, straightforward. Is it symptomatic? Do they have symptoms? Are they burning? Do they have frequency? That frequency is when you go, 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 gotta go, 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 go. Okay? Because you have that bacteria. Or is there no symptoms? You just do your annual and then you found bacteria in it. Or you tired, you just found bacteria in it. Or is there blood in it, hematuria, called blood in the urine, or no blood in the urine? So we have different categories. So when they come with uncomplicated, or the patient say, okay, I'm having frequency, I'm going too frequent, and I'm also, it burns when I go. The patient already knows that I have UTI.
Right.
All right. So when they come, of course, I give them antibiotics. That's all I have in my toolbox, prescription or surgery. So we don't do surgery for UTI. So prescription, duh. Everybody knows that.
Right.
So I give them macrobid. And then they go. A day later, 2 days later, they call back. They have yeast. Because the antibiotics causes yeast infection. So I give them something called diflucan for yeast infection caused by my prescription. Okay, they go. 3 months later, they're back again.
Oh my goodness.
And I'm like,
this is a cycle. Now you're in
exactly.
Right.
So and I'm like, this patient again is back again for the same UTI. I said, yeah, I have. And then they are most people are used to it. And like, oh, I have UTI. I usually have it 2 or 3 times a year, and
Right.
nobody has been able to tell me
That's crazy.
why.
That is crazy.
I'm like,
And then they
what
think
do you
it's
mean?
a part of their life journey.
Yes.
And that's
yes.
not normal.
So I said, no, it's not normal for you to have UTI again. And unfortunately, I just say, okay, so last time we did macrobid, we did antibiotics, 3 days. So let's do it for 7 days this time. If it's the third time, I'll be like, okay, so we did it for 7 days. Let's do it for 10 days this time. Or let's do it for 14 days. It's like, why do they keep coming back? Lo and behold, when I go on the computer, the code is already there. Recurrent UTI. It's already pre-programmed. They know you're going to be back.
Wow. which in we haven't even looked at the cause.
Right.
What would have caused that patient
To have
for
recurrent.
us to have it,
Yeah.
and then to see how we can curb that
Right.
before we even put the band-aid on.
Right. So I'm asking them, of course, the first time, you wear cotton underwear. I'm already doing that
Why are we wearing cotton underwear?
to prevent, heat.
Because it's a breathable
Right.
fabric.
So I'm already doing that. Of course, one partner. I have one partner for 30 years. Okay. And drink water. I drink, whatever, 3 liters a day. They're doing everything that we know. And Dr. Feyi, I've been having this for years and nobody has been able to tell me. So you can even give me, or I'm traveling, can you give me an antibiotic to keep? If I have the symptoms, then I'll take it. If I don't, then I'll save it. They're ready, prepared to have a recurrent UTI. So what causes that recurrent UTI? It's from the inside.
Oh my goodness. What?
It's not just when you wipe or don't wipe, because like I said, they have cotton underwear, they have one partner, they're drinking water, they're washing clean front to back, they're doing all that physical, but yet they keep having recurrent UTI. It's from the system.
Oh wow.
All right. So you have the bacteria in your gut, in your system, in your urinary tract. All right. The kidney, ureters. I'm not going to go into technology, call terms. We don't need all that. Most important thing is you have this bacteria, right? You have this bacteria resident in your body, and it's important to get rid of them.
Yes.
When I give you that prescription for antibiotics, the bacteria will go down to your nerve root and hide. Yeah, and hide. Okay, because the antibiotic might not get all of them. So they go burrow down, dig down, and go hide. So when you take your 7 days and they're smart too. They're like, boo, 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 coast is clear. They stopped it. Let's go. Boom, recurrent. Take it for 10 days. They burrow down there, leave down there, stay down there. And then after your 14 days, coast is clear, let's go again. Then you have recurrent. How about get something that will kill?
Yes.
Kill it once and for all. Kill it. All right. We have trillions of bacteria, healthy bacteria and harmful bacteria in our gut. But every time you have more abundant, bad bacteria, you're going to have those recurrent, infection. Recurrently. Could be starting from your stomach, your acne or eczema or UTI or something, inflammation, because they keep manufacturing, they keep producing. And when you take antibiotics, it destroys, wipes out some of the bad and some of the good ones. So you also want to multiply the good bacteria and also decrease the bad bacteria. So you don't feed your bad bacteria things that they want, like sugar.
What?
All right. When the bad bacteria multiply, they produce toxins. And then that's why you crave sugars and all that, things that they feed on.
Right.
But you realize that once you start, detoxing and start eating healthy, the craving for sugar will reduce. All right. So it's a lifestyle change. Lifestyle change is what prevents UTI. So the main cause of recurrent UTI, other than cleaning and wiping correctly and washing twice a day and wearing cotton underwear and having one partner and just doing what you need to do, but you still have recurrent, is because you have overwhelming abundance of bad bacteria in your body. So you need to take a lifestyle oath that I, going forward, promise to have a lifestyle change and start eating healthy and getting rid of bad bacteria and promoting good bacteria in my system. That will help conquer recurrent UTIs.
Wow. Mic drop. Okay. If you wasn't sure before, there you go. Okay, that was a bunch of information you would have had to pay to get. Because they want you to come back for all these consultations and all this drug selling, and you get no answer for what you can actually do about the situation. That's why I love her. So, one more thing.
Okay.
So we talked about, that was a lot to swallow. I absolutely love how thorough it was, because you said some of the bacteria causes certain cravings. If you look at your life over a span of time, months or whatever, and you realize I do crave a lot of sugar, investigate that, inspect what you expect, and we know we shouldn't be consuming but so much sugar per day, or just
Right.
as a regular. We know it's an inordinate amount, and so we should try to start to curb that, and so we can shelve some things in our health history